The opinions and statements made by the guests of the Success in Practice podcast are their own, and I do not endorse or accept responsibility for their positions. Any information given by myself or the guests is educational in intention and not to be taken as medical advice. If you choose to act on the content involved in the podcast, you do so at your own risk. Okay, everyone, welcome to the Success in Practice podcast. This is episode number 1, the first episode. I'm very grateful and glad that you're all listening and watching. If anyone's listening and watching, and when people listen and watch, I hope that this serves as a tool that you can use to gain more knowledge. That's the idea of it. I'm doing this to really just bring osteopathy to the forefront. I don't think we have enough discussion with people that have been there and done that and practiced osteopathy and have them give us their insights. So my aim for this podcast is to just give people a platform and to have discussions. Now, if you don't know me, my name's Sammy Karam. I've been an osteopath since 2003. I graduated in 2003 and I was one of the fortunate ones that got early registration by being a pain in the ass. And I guess what I aim to do sometimes in this podcast is be a little bit of a pain in the ass and push back on certain topics and really try to just go down rabbit holes and just try and investigate what this is all about in terms of osteopathy. I have a fair idea of what I'm doing as an osteopath, and everyone that I talk to will have a fair idea of what they're doing. And I just want to get everybody's opinion and put it out there and debate it. And hopefully we can find common ground and understand the places that we don't have common ground and maybe discuss those as well. I'm interested in the landscape of osteopathy, especially in New South Wales and where we're headed. It's of interest to me and it's of interest to a lot of the people that I'm interviewing. I will share my personal opinion on stuff, but most of it will be discussing things with people and trying to give and take with them. So without any further interruptions from me, I'll introduce my first guest, and I'm very pleased, honoured and grateful that she's joined me today. I'm joined today by Anne Cooper. Anne is the owner and operator of Central Sydney Osteopathy, located at Petersham in Sydney's inner west. She has been a qualified osteopath since 1989 after completing her osteopathic studies at the International College of Osteopathy in 1989. She completed that whilst nursing at RPA. Anne established the Newtown Osteopathic Centre and then later moved to Stanmore in 2004 and Petersham in 2023. Anne has spent some time as an educator through the years of the UWS Osteopathy program, that's University of Western Sydney, and has either directly mentored, taught, or advised hundreds of students and osteopaths over her many years of practice. At that university was my first contact with Anne, and we have maintained a relationship since. I'm very proud to call her a friend and someone that I look up to. Anne is a life member of Osteopathy Australia and has witnessed its genesis and development over the years. She has served on the Osteopathy Board of Australia as the New South Wales member. In 2021, she completed her full 9-year term as president of the New South Wales Osteopathy Council, which oversees the conduct, performance and health of osteopaths in New South Wales. In 2021, she was awarded the Order of Australia for her contributions to osteopathy. If anyone needs an example of someone giving back to their community, that example is to be found with Anne Cooper. Anne has a particular interest in treating older patients these days. Other than that, she tells me that she has no hobbies at all and can't cook to save her life. But from my personal experience, she eats very well. I used to bring Anne some food back in the day at university, and she used to love all the lovely Lebanese food that my mother used to make. And I think that's one way that that was a way to her heart was through her tummy. And thank you for being on the podcast. I hope this is one of many times we get to chat publicly. Let's hopefully throw some things out there and see what sticks. Thank you again for your time. and welcome.
Thank you. Thank you. I'm so glad to be here. And I do remember your mother's cakes. They were wonderful. Your beautiful mother.
She always made sure, to ask me to take some extra, take some extra. And I was the only student, I think, allowed to use the microwave in the staff room. Look, there's a lot to unpack tonight regarding your clinical experience, and I want to get to that. But I think I'd be doing a disservice if I don't discuss maybe your thoughts on the development and progression of osteopathy in Australia, because you've been so involved in that aspect of it. We really need to get your input on the current landscape in terms of, say, regulation, education, and how to best tackle the next 20 years. So I want to discuss that in detail. You've seen the progression of students to osteopaths. You've seen many people who started out as students have become osteopaths and have either gone on to do things, with different degrees of success. So getting your take on that and what commonalities of success looks like, I think would be beneficial to the listeners. You've been involved in different bodies that represent osteopathy in Australia. Maybe you can share some of that experience. And you've also been involved in education. You were seeing what and how newer graduates are practicing. That's kind of, you're still seeing that. So I'd like to ask you some questions and maybe get you to compare and contrast what you've seen over the many years. And maybe we can discuss how practices, actual osteopathic practices, private practices, have evolved in the last 30 years and what you see as some of the challenges there
Sure.
ahead of us.
Sure.
So there's a bit
Go
there
ahead.
to go through. Is there anything that you particularly want to chat about that you feel like
No,
you want to?
I'm happy to answer the things that you've touted so far, as much
Great.
as I know.
Yeah. All right. Well, let's get started. We'll speak about osteopathy and the landscape in a minute. But I want to give people some history about your evolution personally in osteopathy. How did it start for you? I know you were a nurse before you were an osteopath. Who were the people that kind of guided you through the early stages of either your studentship or your career? And give us some insight about being a new practitioner in those days. What was it like as a new practitioner in those days, maybe in the early 90s?
Look, I think that serendipity has been a very big part of my life. My father was killed in a car. Our father was killed in a car accident in 1963, and we came down from country Victoria to live with a probably terrified aunt and her 6 kids, because my mother was very badly injured too. And I remember laying in bed. This is in 1963, so I've just aged myself very nicely. And there was a book right up the top of the bookshelf in this bed on that first night, which was therefore March 9th, 1963, and it was called Movement is Life. And it just struck me as something that was so obvious. That's the only way that you knew that something was alive and that something was important. Now, that book actually was a major tome in the 1930s, and it was there's a lot of weird physical therapists in those days, not including people like that, is his name Joseph Pilates, but a lot of other people in the 30s. They were related to Nazism, they were related to racism and things like that, but nevertheless, their philosophy, besides the racism, was quite good, that, movement is life. That stayed with me. My father had been a motor mechanic, and I don't know. I did. I thought I was a genius, and I thought I had lots of opinions. And those of you who know me know I still think I've got lots of opinions. I just don't think I'm right all the time anymore. And I did communications at RMIT first, and was completely unemployable, and came back and had to do something to make myself useful. So I did nursing, but I did it in Sydney, not in Melbourne. And then after I graduated from nursing, and I did very well in nursing academically, although to be honest, I was a terrible nurse. I met a woman at a party, and she said, "What are you going to do?" Her name was Karen Dean. She's since died. And I said, "Oh, I don't know. Just, I don't know." I had been offered medicine, but I knew I couldn't do medicine. I couldn't do night shift. And so she said, "Why don't you do osteopathy?" I said, "What's that?" She told me. I didn't really listen. She said, "But you've got to go tomorrow because tomorrow's the last day that they're taking." So I dragged Bruce Sutton along, who was doing nursing with me, and we decided that we would do it for a week. And if we thought it was rubbish, we wouldn't attend. And we certainly wouldn't pay the fee. And if we didn't think it was rubbish, we'd go on. And within a week, we were hooked. We were utterly hooked because it is so irredeemably logical. The whole thing is so logical, and it suits a simple person like me. The simplicity of this medicine.
It's obvious.
Yeah.
And so when you went there and you and Bruce, you said that within a week, that's it, you were sold.
Yeah.
That was my experience when I went to the open day and heard you speak. And so who was that? Who was that really sold you in that first week? Who was that particular person that kind of, spoke and you kind of felt that?
Ivan Lullerman, he was a buffhead, but he was a lovely buffhead. Peter Cash, Steve Porter, Karen Dean, Janet, whatever her name was. Look, they were. It wasn't them, it's what they were saying, which was the philosophy. And even people deride that word philosophy, but there's nothing wrong with it. The philosophy of osteopathy, it was the only thing that made sense. As nurses, Bruce and I had been nursing for 4 or 5 years by that stage, and we knew that nursing isn't about health. It's not about maintaining health. It's nothing to do with medicine, isn't it? It's about cleaning up messes. It's not stopping the mess from happening in the first place. And that's what osteopathy was doing. Osteopathy, from what we saw in that first week, made sense. It would stop these things happening. Now, this isn't a silly thing like silly naturopathy, like you cut it. In those days, you couldn't eat salt, you couldn't eat fat, you couldn't eat butter, all of those stuff, all these stupid things which we knew historically didn't make sense. It was about just accepting that there's this magic about our body, and this is what we were taught. It was about homeostasis. It was respecting homeostasis and maintaining a healthy dynamic homeostasis. That's what osteopathy did. And that's the way still, and I don't think I've really had an original thought since, that's the way I see what we are, what we do as osteopaths. We maintain homeostasis, and when one day we die. We get sick and we die, and there's no stopping that. But until then, osteopathy keeps those fluids moving. And with good diet, and that's a main thing, and good mobility, but not necessarily exercise, but certainly mobility, you'll keep going as long as you should, and then you drop off the twig. That's it.
Yeah, that's correct. You spoke earlier about the philosophy as being important, not so much the person. But I think, and the vessel is important too. The vessel that carries that philosophy and kind of gives it to the next generation, and really the way they communicate that and the way they carry that, and the example that they lead by too. I mean, that's not just for osteopathy, but that's for really all philosophies that have made an impact in the world.
We're being derided now. There's a paper that came out last year or the year before. Some British osteopaths are saying, well, this is silly. Osteopathy doesn't make any sense. Well, they obviously don't do it. Yeah. Because when you do it, it makes sense.
Yeah,
it's absurd. They're the absurd ones.
Yeah, I agree with you. Okay, so what was it like as a young practitioner back then? Well, I mean, a new practitioner.
Wonderful. I was the only one in the inner west. Karen Dean was over in Glebe, and but Sydney was a different town in those days. And I started by myself. I had the confidence. I had the language because I was already a nurse.
Why did you have the confidence?
Because I was a nurse. Because I was a nurse.
Right, but in terms of applying osteopathy, I mean, I met you 8 years into or 9 years into your practice. Not a very long time in practice, given the scope of things. But yet you still seem the same to me in terms of the way that you speak. I don't see a lot of difference.
I'd agree with that. Yeah.
But what gave you that confidence? I mean, why did you feel
confident?
Tammy.
Because people would come to me. People come to see osteopaths. We're at the bottom of the tree. We're at the bottom of the pond, whatever you may call it. We're at the bottom. They come when they've been everywhere else. But having said that, apparently that's what physios say and that's what chiros say. But nevertheless, we still see people when they're at the end of their tether, and you apply that physiological and physical therapy, the physical therapy with a view to influencing the physiology, and it bloody works. I had a bloke come in earlier this year, no, not this year, late last year, and he was in his late 60s, early 70s, and he was incontinent of feces. He's a company director. He's a nice guy, likes a beer, likes too many beers, all of that stuff. But he came for his low back, but he mentioned he's incontinent of feces. So, there could be very few things more devastating than that. So here am I, 68 years old next week, and I'm still thrilled by what happened. I saw him. It's getting a bit much for me to do this now. He came back a week later and I said, how is it? And he said, not much different. And I kind of expect that. And I said, well, what was it like for the first 2 days? Blah, blah, blah. Oh, yeah, it was good. And I said, okay. So, and then it came back after 2 or 3 days. Yeah. And I said, well, that's okay. But tell me, how's your incontinence? And he said, oh, that's gone. Now, my work was the only factor that made that influence. Nothing else changed. His low back and his incontinence were. Why can't I be thrilled by that? Why shouldn't I be thrilled by that? Who would have thought that I could have helped that?
You should be. And what I was alluding to in my question about confidence is that I think a lot of the times when you're new to practice and you haven't had the experience, just seeing people with experience get the results that you just talked about puts a bit of a sparkle in your eye, like it gives you a bit of that kick in the backside to kind of get out there and enjoy it. And so we had that with you guys, and you would have had that. You would have seen osteopaths practice. I mean, and you would have seen them do some great things, and hopefully that would have given you guys a bit of an edge, at least, to say that, hey, I can do this. You began as an osteopath in 1989, and in 98 the UWS program kicked off, and you were teaching. What was that experience like?
Well, I'm a terrible teacher, Sam.
Well, tell us about some of the challenges there that you experienced in trying to.
Well, I remember you. I remember on that open day, because you stood out, and also the first classes, and kids who didn't really know what they were doing. They had no idea. And I remember saying to them, and I meant it then and I meant it now, you people have made a decision which is going to be the best decision of your life. It's going to be one of the best decisions of your life, really, because you may know not what you've done, but this is a thrilling job. This is a really thrilling job. And a few people have mentioned that. They weren't my exact words. You may remember the exact words. But most of them were just there because they hadn't got into physiotherapy, which made me roll my eyes. Because if ever you want to see an unhappy practitioner, go and see a physiotherapist. The poor bastards, they're so underpaid, and their results are really poor. I think I said to you when I last saw you that new graduates from La Trobe University are apparently graduating without ever touching a patient. They're not doing therapy anymore. They're doing exercise physiology. Anyway, so when Peter Edwards and I started teaching at UWS, we had no teaching skills whatsoever, but we were uncontrolled too. We were able to say anything we wanted. There was no such thing as so-called evidence-based medicine. That still hadn't reared its ugly head properly by that stage. We were able to say things and moderate them to some extent. Obviously, I didn't say we can cure cancer, but I'm saying you don't know what you can cure. You don't know what you can cure, and I don't know what we can cure or what we can prevent. And it was just wonderful to see all these kids from Western Sydney, who most of whom would never have had an opportunity to do something like this. And, we've got you're Western Sydney, there's lots of other of those kids there, and they had no passion. But my experience, within a week, they had that passion.
Yeah, it was instant for us. Well, for me anyway. It was pretty instantaneous. And so going through the program, you were there for many years. What did you find was the tipping point there in terms of how did that program change over the years that made you kind of say, well, I think I've come to the end of this, and I
left because they wanted me to pass someone who hadn't in the practical who hadn't attended because she had a bad back. And so I said, I won't do that. I'm not doing that. In the end, they passed her, and then she failed. Someone else failed her properly, using the proper techniques. But also it became, again, so more physiotherapy-based, more physical therapy-based, and more so-called evidence-based, because people came in there, and we see this with a lot of academics, is that they're not able to make a living. in practice, so they become academics. A lot of them aren't like this, but a lot of them are. And so nevertheless, the UWS graduates on the whole were pretty bloody amazing. They really were. And I look at what happened in New South Wales with that huge surge of these lovely, lovely young osteopaths coming in, and they've all done really, really well. A friend of mine's a chiropractor from Macquarie, and she is the only person in her whole cohort who is still practicing. Now, as far as I know, there's very few people from UWS who aren't still practicing. You know, there may be a few mums who are trying to, juggle kids and stuff like that, but most of them that I know of are still thrilled by it.
Yeah, most that I know are still pretty thrilled by it too. You touched on the topic there of evidence-based medicine, and I'm understanding your position. Can you flesh that out for us in terms of what's been your experience and how has that kind of affected your opinion on what's going on in the medical landscape, but also what's happening with osteopathy and evidence-based medicine?
Well, it's a marketing ploy. Of course, it's a marketing ploy. Applying a single variable, variable to individuals across the world as if we're all the same. Now, every osteopath knows that the only evidence, the only body that matters to them is the body that's laying in front of them on that plinth, on that bench. So it's an absurdity to say, well, I'll give this tablet or this therapy to this person and that should apply across the world. And of course, it's ridiculous because the average person on this planet is a Chinese male in China. That's not what we are. We're quite different to Chinese people anyway. But it's an absurdity right from the start. And as far as osteopathy goes, with all the variations that are possible and that occur in the human body to treat people, and we see this in so-called, again, I've got to be in my bonnet about it, I guess, of the physiotherapy, treating people as if they say, well, low manipulation doesn't help, this does help. In fact, what they've come down to now is they say walking and Panadol is what helps. Well, who benefits from that? The insurers and the government. But it's an absurdity to consider that everybody is the same and the variables of each person are the same, and therefore the interventions should be the same. It's ridiculous.
Let me push back a little bit on that, because I think it's good to kind of get your thoughts on it, especially when it comes to testing though. Like when we're using tests like standing flexion tests and sacral torsions, and we're talking about certain things in that sense, and we make claims that a backward sacral torsion is causing this particular pain or this particular issue. I think the critique from the evidence side is that you can't make those claims because you can't correlate the tests. They're not valid, they're not reliable. Two separate practitioners will have two separate findings. But what do you? What's your answer to that critique?
They're not talking about people. They're talking about models. I've got an identical twin. My body is quite different to hers. Let me tell you, I can't treat my body the same way she treats hers. We have different issues. We both had the COVID vaccines, and she developed bowel problems, diverticulitis. I didn't. We're not the same. We are not models. We're not mathematical models. None of us are, because, as I say, my identical twin has lived a very different life. She's had babies. She's done all that stuff. I haven't done that. I've lived in Sydney most of my life. She's lived in Melbourne or Victoria most of her life. Very, very different. There are no two identical individuals. No one.
Okay. All right. Let's move on from that. You finished your 9-year term as the New South Wales Osteopathy Council president recently. You've seen some of the so-called skeletons, of the profession. What were some of the more common complaints that you had to deal with? Hello, everyone. I'd like to take a quick moment to thank everyone for watching and listening to the podcast. If you have received value from this episode, the kindest thing you can do for me is to like, share, follow, and subscribe to the channel on whichever platform that you are listening on. If any of the conversations have resonated with you and you feel that I can help elevate your practice, you can find me at successinpractice.net. That is, the Success in Practice program can be found at successinpractice.net. The Success in Practice program is the signature program that takes a practitioner who may be struggling with retaining patients, They may not be certain about building effective treatment strategies, and they may feel somewhat anxious and doubtful about what they are going to do with a patient. And they are not really accelerating in the real world of private practice. It takes this practitioner and it turns their careers right around to the point where the patients have an effective diagnosis and a real treatment plan that they can take home. Patients are happy to book in multiple sessions with you, and they are confident about your abilities. And more importantly, you now have direction and are confident about your own abilities. The program streamlines how you operate as a practitioner. Guys, you should have been taught this at university, but you weren't. You may have been practicing for the last few years thinking there has to be a better way. There has to be a more effective way of engaging with patients and getting them results. Well, there is. And this is what the program delivers. Go to successinpractice.net and check out the options available to you. See where I can help you easily grow your patient list and finally earn the rewarding income that you deserve. For all the information on how you can reach me personally, check out the show notes. Also in the show notes, you'll find a link to the chat transcripts from these podcasts. These are valuable and a wealth of information. I really hope that you're enjoying the podcast. Guys, leave a comment if there's any questions on this episode. And please, don't forget to like, share, follow, and subscribe to the channel. Now, back to the show.
For the most part, it was sexual complaints. They're called notifications. For the most part, it's notifications on either direct sexual assault or intimations of sexual stuff. That was, for the most part, young men who had graduated 4 or 5 years later and thought they were amazing. There was no sense of humility. I remember one of them saying, "She should be grateful I see her. I'm the best." And actually another one said that too. "I'm the best. They should be grateful I'm seeing them." The other type of we saw a lot of was older men, and for the most part it was men. I'm trying to think. I'll think if there's any women. Yes, there was. And they also thought that there was nothing they could do wrong, and their treatment, if not sexually invasive, was often just dangerous. You know, fasting, absurdity, over-treatment, but usually sexual. Usually, it's. I don't know why they can't stop themselves, and don't know how much risk they are at. You know, all you need is a towel. All you need to do is cover a body, because no one's ever got raped through a towel.
Yeah,
and you don't need to ask a girl about whether she's got a boyfriend or not. You don't need to do that
No,
stuff.
it's something we were taught very early on. I remember Peter Edwards was a stickler for that stuff. You know, if he was teaching you something on the bench and you didn't drape the patient with a towel, he'd pull you up on it right quick. And so, I mean, you know, it's not. I don't think it's a stain on all men, especially all male practitioners. But yeah,
because most men don't do it. Most men are sensible. I don't know why these men lose their inhibitions. As for the women, that's often over-treatment, one sexual thing, having a sexual relationship with a really disturbed patient, same sex, but that was just before my time, and that wasn't treated seriously. If it was a man, they would have been deregistered. If it was a woman, she got a slap on the wrist. And
so, did most of these end up with deregistration, or were they just
some from monitoring? Yeah, probably half of them at least deregistration. Okay. And they'd be deregistered or the registration would be cancelled for several years, say 3 or 4 years, which meant they'd have to go and do the course again.
Yeah, right. What advice would you give to younger osteopaths who might deal with a complaint? It may not be a sexual complaint, but it just could be a complaint from a patient. You know, hey,
somebody else. Go as soon as you feel like, look, women know when they're being sexually assaulted, even if they're not. I'm not talking about literal assault, but when a man is speaking to them in a way, or a woman, in a really suggestive sexual way, they know. They will lay there. They'll look at the ceiling and they'll wait for it to pass. They'll leave, they'll pay their bill, and they'll go home and they'll say their flatmate or their mum or their sister, this happened today. But if you aren't doing it and they're sexualizing you, because we all get in strife with that because patients sexualize us. We put our arms around them. We say we're giving them a cuddle. You know, it's pretty intimate stuff. But if you feel in any way uncomfortable, you must make the notes. You must go and talk to somebody else and tell them that you feel really uncomfortable with this particular patient and try not to see that patient again.
And in terms of actual, maybe not so much, like I said, sexual complaints, but complaints just about treatment or about business or about, you know, hey,
just
you
give them
know,
their money back.
right, yeah.
Give them their money back. Stop fluffing about, really. It's give them their money back and that'll shut them up. If it's damaging treatment, that's a different issue altogether. But if it's just that they thought that, and we've seen this a bit, people on a merry-go-round of treatment, which doesn't do any good. I mean, we all know that stuff, but
yeah,
their money back.
Okay. You've been someone who people see as a good place for advice, especially for younger practitioners. What kind of questions do younger practitioners come to you with, maybe in confidence? You know, do younger practitioners call you up and say, hey, listen, I'm having this problem? You know, what kind of questions have you been faced with that lead you to think that we need to maybe stop and rethink what we're doing as a profession? So I'm not talking about, I want to move on from the council stuff, but more so in terms of practice, maybe in terms of remuneration or in terms of, you know, not seeing enough patients, or I'm not happy, or I'm not practicing osteopathy, and, you know, these kinds of things. What things have you heard?
Well, they're not practicing osteopathy. I think in the last three years anyway, we've seen the Melbourne practitioners especially really deeply suffered with COVID because they were really without any patient touching, any articulation with patients at all for 2 years. And all they learned was exercise physiology, that stuff. And they came and they really were pretty bloody awful. But they're smart kids and they're nice kids. And they were embarrassed. They weren't very happy about not being very good at what they did. This is my experience with the ones that came up to Sydney. And so they worked even harder. And it was great for me in that what I saw is that they had to just abandon what they had and hadn't learned in the last 2 or 3 years or the last 5 years of their practice and start again. Because, you know, I was like a dog with a bone. I want you to stop. I don't want you to sit there and take another history for another 30 minutes. You've got the history in front of you. They've already filled it out. Lay them down, feel the body, measure everything, see what's balanced, see what's not, see what's tender. Keep talking to them and find out what's going on from what they're saying. You've got the history. You know whether they've got cancer or not. And if they have got cancer, you know what? There's not much you can do anyway. If they have got cancer, you're going to have to handball them somewhere. If they have got high blood pressure and they're going to pop a vessel, they're going to pop a vessel. But you'll be able to pick that kind of stuff up anyway with your palpation. That's my experience, is you can pick that stuff up. And, of course, you take their blood pressure. Around mid-year, I start getting phone calls from people who are very unhappy with their engagement with whoever has engaged them, and that's always underpayment or a failure to pay. I mean, the amount of young osteopaths who are just not paid. I don't know what the principals think these kids are supposed to live off. I suppose they're meant to go and get a job at Bunnings, but, you know, they're being paid $700 a week. They can't live on that. They're paying $600 a week rent. And they're being disrespected and they're desperately unhappy and they're saying things like, I'm not being mentored and blah, 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 because the practitioner who owns the joint is too busy. Like one recently saying, you know, he's charging for workers' compensation because when I see a patient, he sticks his head in and says to the patient, how are you going, Sammy? And the patient says, okay. And then he puts it through on his account, you know. That's regarded as a treatment. So they're very vulnerable and but very smart. I really love them. I really love them. And I think, and when they hit their stride, which takes about 8 months, then there's no stopping them.
So for that first 8 months, then, I mean,
they're like babies.
Yeah, and as a clinic owner, you're not going to, I think you have to come to terms that maybe for the first year, you're not going to make money on you're not going to really make money on a new grad. You're going to have to invest.
Mm.
And I guess, what's the guarantee that they're going to hang around after they hit their stride? And there's no guarantee. I mean,
No.
unless you have them as an employee, but that's not what we're doing here in Sydney. Not what most people are doing,
Mm.
unless they're an employee. But even as an employee, they can just give you notice and leave.
Mm.
And I guess you have to make it a place that they want to work at. You have to
Yeah.
make your practice somewhere where other people want to be. But really, for that first year as a principal, you're not going to make money on the graduate. So you have to keep working. And you've said this to me many times, that you have to make sure that the graduates get enough attention that they can hit their stride, because they'll never make anything for you unless they get better. And you have to invest that time. All right, so
But
based
they'd have to leave, Sammy, like you did. You worked with me. See that language? You didn't work for me. You worked with me.
yeah,
And naturally, it's of course, with your level of intelligence and capability, of course you'd go and set up your own business. Of course you would.
that's going to happen. Yeah, with especially if you have a young practitioner who's, I mean, I'll just call them, if they're a superstar, if there's someone who's just doing great things, their palpatory skills are great, they have a passion for what they do, they're humble, they work hard, they're going to want to go out on their own. And if they don't want to go out on their own, they have to be well remunerated. Like they need the upside. So from a business point of view, their upside can't be stifled. If someone, I mean, there's nothing wrong with, if they're making you plenty of money, there's nothing wrong with putting them on a flat fee and having them
That's
put the
right.
pedal down.
But the issue is now is that there's enough osteopaths. I mean, you went to Parramatta. There was, I think, only one osteopath in Parramatta when you went there, and you had connections there. In Bankstown, there's hardly anybody. But now to go to a place where there's not many osteopaths, you really have to go rural. And it's very hard to go rural or regional and be a new graduate, because you won't learn and you won't develop alone. You can only develop by sitting in the tea room and watching your friends work, your friends being your work colleagues, and just taking it all in. But if you work alone, you will stay exactly the same. People at work went straight from university and work alone, they're still doing the same things.
Yeah. You've seen many students, just to follow on that, on the next question then, you've seen many students develop into competent practitioners.
Yeah.
What are some of their common traits?
Sport.
What do the good ones have? The successful practitioners?
Sport. Team sport. Now, of course, there are always exceptions to the rule, people with really strong personalities and that. But when you have kids, they're not kids, but I'm calling them kids, who've played sport, they know how to win, they know how to lose, they know how to share, they know how to talk. They're people who know how to articulate with other people. So I think sport's a really big thing. And they can't be concrete. They can't be concrete about, I dislike this word mentoring, but they can't be concrete about what medicine is, because no one knows. No one knows what health is. We only know what sickness is. And health has been monetarized anyway. We're all trying to be healthy, but that's no different to, Scientology, Freudian psychology, Weight Watchers. You're always looking for a goal that you can't define, but you're always trying to get there, and you'll pay big money to get there. So if you think you know what health is, then there was a saying in the 80s, which I didn't understand at the time. It took me a long time to understand. I thought it was just hippie rubbish. And it was a book. It was called, "If you see the Buddha on the road, kill him." And so all the hippies were reading this book. And I took no notice of it, but I've always remembered it and thought I just didn't get it. Now I know what it means. If you come across someone who thinks he knows all the answers, he or she is a liar. The older you get, especially as an osteopath, the more you don't know. And you just have to accept that. But that's part of the thrill. That is part of the thrill.
Okay, so is there anything, you've answered that, the sport aspect of it, in terms of being socialized, knowing how to talk to people, knowing how to communicate, working in a team environment. Technically speaking, though, what have you found to be some of the common traits of the practitioners that do very well in terms of their application,
Oh, well, of course,
their skill set?
you know, you're speaking to a biased person here. I'm a fascial practitioner. I manipulate. Manipulation is a fascial technique. When you are manipulating the spine, it doesn't matter about the spine. It doesn't matter about whatever the chiropractors call it, subluxation, all that stuff. Every time you manipulate any joint, every time you mobilize a spinal joint, a glenohumeral joint, a hip, whatever it is, you're releasing fascial strain, which is pure osteopathy, utterly pure osteopathy. So once you have that in mind, that you're treating the whole body, and because I've got a short attention span, I use manipulation and I'm very good at it. Well, I was. The ones who do really well are the ones who primarily manipulate the body and start at the bottom, well, start at the pelvis, then go down to the feet and then work their way back up and see what they find. They sweep up dysfunction on the way up using that fascial technique called manipulation.
Right. Okay. So with obviously the manipulative skills, and I think even, you know, you talked about some of the practitioners that maybe were teaching at the college that you attended, and a lot of those practitioners are probably doing more indirect work at the moment. But all of those practitioners were great manipulators.
Beautiful manipulators.
Great manipulators. And one of my messages is that, you know, don't try and run before you can walk. And people that want to kind of just graduate and go straight into cranial.
Well, it doesn't work. I mean, cranial doesn't make sense. Cranial as a fascial technique.
Whatever your thoughts are on it, it's something that you need to develop. And your manipulative skills, the more fascia you can manipulate, the more feedback you're going to accumulate, and the better you're going to get. And
beautiful. That's exactly right.
That's the
But
that's the first sign.
I think it's dangerous to say that, you know, you don't run before you can walk, because cranial is not, and any of those things, myofascial technique, they are not superior to.
Well, I'm not saying they're superior, but in the eyes of the people who want to be those kinds of practitioners, they feel like it's superior. And I'm just saying, if you want to do that, your prerogative, do what you like. But, you know, it's a progression. And if you want to be successful at something, you know, success leaves clues. And if you want to be successful, look at the practitioners that have become successful at that, and all of them were great manipulators.
Yeah.
You know?
But these people never had big practices. They never did that. They never had, well, they could never, I hate this word, but I'll use it, they could never mentor, because it was so passive and so, well, as you know, nothing appears to happen, which just doesn't say nothing does happen. But it's not a successful business model.
No, I guess it, but that might not be their motivation. You've been around long enough, and you've seen in terms of the application of osteopathy, and what the current tertiary institutions are teaching. Do you think that they've maintained a level of osteopathic fundamentals that is doing justice to the profession?
Well, the profession has changed a bit now, but no, it's certainly not. When I was on the national board, I had to fight very hard. There was one discussion about osteopaths saying that they treated asthma, and I said, but they do. And that went down like a cup of sick. And I said, look, okay, I won't say I treat asthma, since we don't know what asthma is, but I'll say, all right, we don't treat asthma, but we treat the symptoms and the signs that are associated with asthma. And that seemed to satisfy them. So that's the kind of silly game we have to play, because all of us have treated asthmatics, and all of us have had what they told the patients, because after all, it is a very subjective thing when you're asthmatic, that the patients say, oh my God, that is so much better. Or the mother will ring you and say, I haven't had to use Ventolin. My child hasn't had to use Ventolin for 4 nights. You know, what's going on? Well,
the customer's always right?
Yeah, but not when you've got, you know, what's the biggest drugs in the world is Ventolin or whatever those steroids are. And I love steroids, by the way, but, you know, that's when you're really, really sick.
So if you feel like the current tertiary institutions maybe are not, or maybe are losing some of that essence, how can we help as a profession? What do we have to do better as
Look,
practitioners?
I think we have to stop being focused on being registered. I don't think it's that important to be registered because our patient numbers will stay the same. People we will reach and people we'll help. We're very happy calling ourselves doctor. We can do that anyway, but we're very happy doing that, and we're very happy saying we're registered and we're up there with the doctors and the physios and all of that stuff. But as long as you're registered, then you have them telling you what you can teach, and I think that's our danger, and that's what you saw. Even though when you were first taught and when I was first taught, there was no limit to what people could teach. A lot of it was mad, but most of it wasn't. It was based on patient results and patient experience. I think we've got to stop worrying about whether we're registered or not. I think we've got to stop worrying about being in universities. We could be in private colleges. That's what happens in the UK.
Well, the pushback against that is that, well, if you're not registered, you don't have access to health funds, and if you don't have access to health funds, that's a massive.
Massage therapists have access to health funds. Acupuncturists do. Well, they are registered, but no, that's not true. No, that's about status, and we're all concerned. A lot of these people just think they should have just gone off and done medicine and sat in a small 2x2 meter room listening to people writing out scripts for metformin and whatever other antihypertensives. But it's about status, and I'm very proud to be an osteopath. I'm really grateful to be an osteopath. I don't know if that's when you speak to your local GP, they're just pretty bloody miserable. But we're worried about, people are worried about status. We are at the bottom. When it comes to the registrations, no, there's one group that's lower than us, but we're at the bottom. We're never going to get there. The hospital-based practitioners patronise us. When you say I'm an osteopath, they have no idea what that means, but they certainly don't respect it, and they don't want to know about it until they need us themselves.
One of the things that I want to segue into later on is to get your views on how we handled COVID as a profession. But just speaking on that, what you just said about being respected, it's funny because during that time, during COVID, we were kind of. I felt that I think the medical establishment did us more justice than what we did ourselves. They asked us to continue practicing. Yes, you said don't shut down, and yet there were still practitioners out there who were adamant that they didn't want to harm Nana, and that they would shut down their practices until further notice.
Well, which is ridiculous because
that's my personal opinion on that. I mean, you could debate me on that.
Well, I know. I just finished my role as the New South Wales president, so I was quite close to them still. And the only body that could make that decision whether we practiced or not was the New South Wales government. The New South Wales government did not tell us to stop practicing. Well, so we kept practicing.
That going back to my point is, I feel like the medical establishment, when push comes to shove, and they know that there's something in the air that may be threatening to the health of the community, they want us on their side. They know that we do good work. They may just not want to admit it.
The ones that know us know that we do.
Yeah.
The ones that know us, but most of them don't know us. And I don't know. The last thing I want to do is go and buy some croissants and chocolate for a doctor and go and get him or her to listen to what I say. I mean, how embarrassing is that? I don't want to do that. No. I want our patients to say, I went to see Anne Cooper and that was wonderful. She fixed my back. That's what I wanted, or my asthma or my headaches or my mastitis and whatever it was, incontinence. But that's what I wanted.
And so you think not being registered won't have an impact on that?
No, I don't think so. But look, we are registered and that's not going to happen because AHPRA is not going to go without our money. AHPRA is very money driven and they love our money, and they don't really care what we do. In fact, what AHPRA is trying to do with all the physical therapies is make us all the same. So the chiros, the physios, the osteopaths, exercise physiologists aren't registered yet, but maybe they are by now, but they'll just have the same rules for all of us, which means we all have to talk the same language, and that's been reflected in the universities. So what's happening at La Trobe University is happening at RMIT, it'll be happening at VU. My great nephew has just started osteopathy at VU, and he's already, they just do it in blocks. They just do the whole thing in blocks.
Yeah.
He'll be fine because his dad's an osteopath, and he'll go and work with Chris. But it's not osteopathy as we know it. And that's where you and I and my nephew Chris and all of us who are ridiculously osteopathic osteopaths will get into them within that first year and give them the thrill of our job, which is a bloody miracle. Our job is a miracle. It really is.
So let me then segue, because you touched on that you know, they're trying to make us all treat in a similar fashion, whatever that may be. You've been vocal about the trend of exercise science and medicine kind of being molded together. Can you flesh out that position for me and for the listeners, given that recent graduates may not have heard another opinion? You know, everyone that's been at university has heard about the exercise science aspect of it. Tell us your position on that.
Well, again, you've got to, cui bono is the Latin phrase. Who benefits? Who benefits from telling people to do their own therapy? At Sydney University, where they had third-year physio students doing low back manipulation, they cannot do low back manipulation. Neither can third-year osteopathy students. And saying, well, it didn't work, so now we know that low back pain does not respond to manipulation, but it does respond to Panadol. Panadol costs less than $1 a packet. So who's benefiting? Medical systems, insurers are benefiting from that kind of rubbish. Who's benefiting from saying that problems are caused by weakness? Now, that's what patients will say to me, and you'll hear it all the time too. They say, I've got a weak quad, a weak something, I don't know what else it is.
Weak core, that's the big one.
A weak core. I mean, core is such a farce. The human body does not work that way. And
the worst words in the English language begin with C, Anne.
Well, this is a farce. The guy, the physiotherapist in Brisbane who came up with this rubbish, it's unanatomical. These muscles of the core all have the same innervation. They can't act independently. They just don't. It just doesn't do that. But there's something in the thigh that they say gets weak and all that stuff. And I say it's not. We don't treat weakness. There may be, but basically we treat spasm, we treat contraction. So further contraction, it's like hitting a baby to stop it crying. Our job is to get in there and spend our time there and make those tissues relax, make the fascia and therefore the muscle and therefore the vessels taking blood to tissues and the vessels removing fluid from these tissues, make it all relax so the flow is back in there again. That's all it is. And then with a good diet and reasonable mobility, then you'll have a good, sustained, healthy homeostatic system. That's what it's about. But blaming everything on weakness puts the load of the blame on the patient. You're weak. And they don't just mean weak in terms of muscles. They mean in terms of personality. They mean in terms of character. These young things wearing their sports gear while they're treating you, telling an old woman like me that I've got weakness, I want to punch him in the nose. No, I don't have weakness. I've got spasm. Fix it.
Yeah, look, I'm gonna discuss this with you a little bit more, and I'm going to give you my position on this, and that may be a little bit different to yours, and I want you to critique that. And so the way I practice at the moment is obviously I do exactly what you've described. We unwind strain patterns. We find a fascial strain pattern. We unwind it. The tissues love it. They relax. They feel better. The patient is out of it. Whatever you want to call it, their inflammatory state, all that kind of stuff. It improves. And then what I do is I say, look, if you want this not to come back, one of the great options you can do is actually get stronger. Now, I'm not saying that you're weak, just saying that you can get stronger. And what the increase in strength will do is just make you more resilient to the everyday stresses of life. And if you do that, it's preventative care. It's just telling somebody that, if you go and do something that's physically hard, it's going to improve your strength. And I think in the absence of hard physical work, the human body isn't at its best, right? In the absence of hard physical work, the human body doesn't perform at its best. And I guess we want to give patients our best. And that's why I recommend that they do squats and deadlifts and things like that. And if that's something that they go and do, it makes them more resilient to the everyday stresses of life. Now, I'm not saying that should be the treatment, right? The treatment is what I do in the clinic. Once I get them out of the problem that they've come to see me for, we advise them to go and then get a bit stronger. So is that antithetical to what you're saying, or is it?
No, that fits in exactly. But you can only do the strength, and you can only do the mobility once you've taken out the strain pattern. But it's brought up something else for me, Sammy. I totally agree with you. I mean, those of people like me who've never been to the gym in their life, best I've ever done is ride a bike, which I like doing, and played netball. But, I'm a woman. And this is the thing I want to bring up, is that women, I'm seeing this with girls all the time, are acting in ways and exercising in ways that don't suit women. Now, there's no one more feminist on this planet than me. But when women act like men, it damages them. And we're seeing this with whole football teams. When in rugby league, rugby union, and AFL, whole football teams are having to have their ACLs done because just before they menstruate, their ligaments go to pot and they rip the guts out of their bodies. Women are not men and men are not women. And even though that's a radical thing to say, but the two are very, very different animals. And it upsets me to see women thinking they have to be like men in order to be healthy with the capital H. There are many, many paths to the mountaintops, as someone.
Yeah, look, there are.
You can walk, you can swim. You don't have to do it. You don't have to do deadlifts.
You don't have to. We just give the optimum, the best, and then you can decide any level of that you want.
Whatever suits you.
Yeah, whatever suits you, right? Now, I have this discussion with patients, and I say to them, look, especially women, and I'll say, your great-great-great-grandmother never had this problem. She did all her washing by hand. She, carried heavy things around all day long. She labored, and she was often out in the field doing hard physical labor. And we don't have that now, and especially women. They're not, women are sitting behind desks now, and there's an absence of some kind of hard physical exertion for both men and women, right? And I think that's a problem from a health perspective. I think it's a problem not just musculoskeletal speaking, but even from a blood work point of view, and hormonally as well. I don't think that. I am going to kind of maybe disagree or push back a little bit in that, I think women can lift weights. I've seen women do it, and they do it very well. I've got my mother doing it right now, right? And she's had a hip replacement, and she's osteopenic, and we've been able to reverse that. But the stress has to be heavy enough to make a physiological change. And I'm sorry, clinical Pilates doesn't cut it. Laying on the floor, lifting your legs up in the air and doing flutters isn't going to cut it. Going for a walk, as lovely as it is not going to cut it. Going for a swim, it's not going to cut it. And
no, so it's not weight bearing. That's right.
You need to give something that's going to get you to where you want to go. And I think we're letting down our graduates by giving them all this exercise physiology crap. Carrying a band around like they're in a circus, waving a coloured band around whenever they've got a shoulder problem.
Yeah,
it's not doing them. It's not doing them any justice. And the way that I use maybe weight training, if you want to call it, or strength work, it's in line with what I feel, what I think is an osteopath. I only ever give compound movements that require the whole body to move as a unit, that train hip hinging and sitting down and standing up and pushing something in front of you and pulling something towards you. But I do that. I do that once the strain pattern has come out of the
that's exactly my point. The first thing is to get rid of the strain. But the other thing, well, as I say, I'm 68 next week, and so you can send presents. But my job for the last 35 years has been extremely physical. So I can't talk because I
Yeah.
don't do exercise. I hate it. It does my head in. But the other thing we don't talk about, and this is a real disappointment, is diet. These ridiculous diets that people have. We know what people should eat. They should eat food. And it should be real food. And it shouldn't be too much of it. But we're seeing the vegans with B12 deficiencies and depressions and chronic fatigue syndromes, of vegetarian women like this, the various things that are going on now. What else is there? Paleo. Oh, God knows what it is. Everything has been monetarized anyway. We know that's what it's really about. When, I know what people should eat. They should eat what our ancestors ate when they could possibly eat them. Like, look at your food, Lebanese food. Who could do better than that Mediterranean diet? No one. No one could do better than that. And, I saw a patient yesterday who's got every disease in the world and blotchy skin, little pimples. And, she's just like about to turn 55, I think. And she says she's got chronic fatigue syndrome. Darling, start eating proper food, because I know you're not eating proper food. I know it. And we don't talk enough about diet. We talk when it's blatantly obvious what people need to eat. Food. That's it. Not protein bars.
Yeah, food from the original source.
And they're not learning that. They're learning macrobiotics and rubbish like that, or macronutrients. I think that's the word.
Oh, look, one of the things that I hear about is this biohacking. I don't know if you've heard about that. People taking supplements and doing all these different things. I'm like, the best like, just eat well, sleep, get your sleep sorted, get your food sorted, go out for a walk every other day, move something heavy around, and that's the best biohack you can give yourself.
But young people are worried. They're very worried about things. They're worried about not being able to buy a house. They're worried about the food that they eat. They're worried about petrol fumes. Who taught them to be worried? Who told them? When you're young, don't worry. And when you're a new graduate, suck up the money that you're going to earn. I mean, the kids that I'm working with, they're not kids, but they're not 30 yet. They're still earning their $2,000 a week. They're doing very nicely. And I say, go and spend it, because you don't have to worry. You will always be okay in this gig. If you really want to make a truckload of money, go to Forbes, go to Dubbo.
Yeah.
Make a truckload of money out there.
COVID taught us that. I mean, I think we did the best business we've done.
I love COVID. I love COVID. We go back to what you were saying about COVID. We kept open. We got a bit of pushback from, in fact, one GP saying, you shouldn't be working, and you can shut up, love. I didn't say. But we continued to treat. We continued to treat people with COVID. We did a little thing on, we saw about 30 patients with long COVID advertised. If you've got long COVID, come and see us. And all we saw was what those people had was an exaggeration of problems they had beforehand. And it was very easily knocked on the head. We didn't charge for those treatments, and we only saw them 2 or 3 times. I love COVID, but in New South Wales, it was great for osteopathy. It was terrible for all Victorians.
So how do you think we handled that as a profession in terms of?
Well, once we kind of pulled our finger out and people stopped listening to each other and just listening to what the New South Wales government told us to do, which was keep working, I think we did really, really well.
Yeah,
it was great. It was. I really enjoyed the whole thing.
Yeah, those. I mean, I don't know if I'd say that I enjoyed it. I didn't, but in terms of just operating, it was one of the busiest times that we've experienced.
Oh, it was fantastic, and that's when we got two new graduates in that time. So they came in with no skills, and they had to just drop everything, disbelieve everything they'd been taught, and start again.
Yeah,
because these people, we're going to try and stop. If they've had COVID, we'll try and manage it. If they haven't had COVID, we'll try and keep them well.
You practiced in an era where there was, for maybe 10 to 12 years, a steady stream of students graduating in Sydney. Compare that time for us, and compare that scenario with the one that we're living right now, where especially over here in New South Wales, we need to beg people to come and work. I mean, how's that affected your practice? I know that you're probably thinking now towards the end of your career, and my personal opinion is that it's kind of past me too. I mean, like, You know, how do you, how, I think it's been very detrimental for us kind of growing our practices and having the profile of osteopathy grow in New South Wales by not having a course in Sydney. And so, you know, compare that time of having all these wonderful students come out and practice in Sydney versus now, where we need to really go out and beg for our for people to come and work.
They don't believe us, Sammy. They don't believe that when I say, look, I think I can pretty well guarantee you at least $1,500 a week. You know, they don't believe it because that's not what's happening in Victoria, because there's such a surfeit of osteopathic students in Victoria that they and getting back to that thing, they're full of fear. I don't know what they're fearful of. I mean, why wouldn't you want the adventure of coming to the most beautiful city in the world on graduation? But having said that, I've got a clinic. I've got 8 people. 4 are off through May, having a holiday. Thanks very much. But and they've all come from elsewhere, and they're all doing really well, and they're really happy. And they, as far as I know, I think they're staying in Sydney. But I don't know where their fear comes from about moving to outside of Melbourne. I don't know where this really quite devastating conservatism has come from.
Well, I think you know, anytime you move away from your family and where you grew up, I mean, you're going to have some anxiety attached to that. I don't think that goes away very quickly. And as much as we want to think that we're progressive beings, we're actually we prefer being close to our family and our friends and getting them out of that.
They can only earn, you know, what is the base wage? They're being paid $50,000 a year, which comes down to $700 a week. You can't live on that.
You can't live on that, but they're coming out here to make more money, but yet they're leaving something behind that's precious too. You know, that's worth something as well. And especially if you're a young male or a young female, and you've got a partner and you want to have a family, and you start thinking, well, I want my family to, you know, be close to my other families, and we want our children to grow up together. There's nothing wrong with that. And that's a fear that people would have, that they have to move somewhere to make some money, and that's not ideal. So I think that should be a real focus for the profession in terms of having a course here in Sydney. That needs to be something that
if they're doing at VU, they're doing courses in blocks. Like Xavier, my nephew, great nephew, he's already done biomedical science. He's doing an exam now. It's only May, and we know that VU has a campus in Sydney. We know that Southern Cross has a campus in Sydney. I don't know if RMIT has a campus in Sydney, but surely there's a way that those blocks can be done in Sydney, and surely there's a way that we can find a way to have a student clinic, or that students do their hours in clinics like yours and mine, where you and I are required to do a undergraduate diploma or certificate in teaching, something like that, something which is required to make the teaching, and that we have to conform to certain standards to get those kids having their degree, doing their blocks, and doing their training with us. But we've been let down. There's just no question of that, and people can blame everybody in the world about that, but in the end, this is the way that education is going, except it seems with osteopathy. You know, nearly everything is online. So the only thing that needs to not be online is the practicum, and that can be done in private clinics if they ask us and require us to have certain certificates or diplomas or whatever it may be, as practitioners.
It seems like somebody's just got to get a whole bunch of smart people in a room and butt their heads together and come up with a solution. And I guess it's got to be made. I mean, education's a business now, and we're just going to make it profitable for them.
Well, I think they have to talk. I mean, osteopaths are the ones that graduate. Again, they might be sullied a bit by Victoria, but osteopaths in New South Wales are making a truckload of money on graduation. I mean, gosh, you know, I looked at today that their grosses was $4,000 a week.
Yeah,
yeah. They have to pay their fee after that, their service fee after that, but that's still $2,500, $3,000 a week.
That's not bad for 1 or 2 years out of university. It's not bad quid, no.
And
Right.
they're not busting a foot, they're all part-time.
Yeah.
Having a very
Yeah.
nice life. I
And
love
so,
it.
speaking about that part time, I want to get your take on you've been an advocate of this, and this is a conversation I've had with you over the years that I maybe I've gotten you wrong, but I haven't liked this, and I have this. I hear this a lot, and this whole work-life balance. And you've always told the graduate, make sure you take a holiday, make sure you do this and you take time off, and I'm the opposite. I'm like I'm actually happy when I'm at work.
Mm.
And so when you were a young practitioner, did you work hard? I know that you may not have found the work hard because you loved it
Oh, I
so
did.
much,
I did. I
but
didn't know.
but hard
I couldn't
work.
believe the money. I
How
couldn't believe the
important is
money.
that in the beginning? I mean, to kind of just
I
put your
was
head
seeing
down,
18, I
your bum
was
up.
working 4.5 days a week, and I was seeing about 18 patients a day. But, I couldn't believe the money. There was no credit cards generally then. So I'd just come home pulling this cash out of my pockets and look at it and think, how did this happen to me? I mean, what is this? I'm doing something, it's not even work. But eventually it took its toll on my thoracic cage, and I started drinking too much. I'd come home and I'd just be staring into space, and there's nothing better than 3 glasses of red wine for that. But of course, there was nothing worse than 3 glasses of red wine for that. So I was making more money than I could ever imagine, and it's all different. And of course, it was all untaxed because it's
Yeah.
not as if I was going to tell. No one even thought about those things. But I think that women need to be very careful about it. I think the boys are stronger. Again, men and women are different, and women can get really knocked about because women like money as much as men do. And you can't, and also it's very hard to say no when someone says, can I see you? I really need to see you, blah, 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 until you add it onto your list, and that takes you up to 20 a day. And, that it can tip you over. I do think women have to be very careful.
And so, what are you seeing with the people that work for you? I mean, if they say they work a good 10, 12 week block, and then they take a holiday for a week or two, and then they do another 4 weeks, and then something else comes up, and they take a weekend off. Excuse me. Does that eat up into their appointment book?
Of course it does. And as I said, it's May. I've got Harry's going off for 5 weeks to do acupuncture, medical acupuncture in the UK. Alana's off. Taylor's won a trip to see Taylor Swift in Paris, and Stefan's gone to Machu Picchu or something like that. So I've got 4 people off. But they all know that they're not my employees, so I can't stop them doing it. I'm not real happy about it, but I can't stop it. And it was just an unfortunate thing. But I have to just take it on the chin and know that when they come back, they'll be working like buggery to get their numbers back up again, because they haven't got any income over there.
And they can't come back and complain and say, "Hey, I'm not busy." Like,
no,
what's going on?
They know. Each of them knows by now that the cost of a holiday is probably 4 weeks of desolation afterwards. So they have to plan for it very well and book those patients in and make more contact with them. And I don't like it, but I'm all right. I'll do okay.
Okay.
Yeah.
You're a life member of Osteopathy Australia. You've been given the Order of Australia for your services to osteopathy. That's no mean feat. That's not something to be taken with a grain of salt. Some people may disagree with you, but I think your commitment and passion for this profession speaks for itself. What do you like about the future of osteopathy? And I'll start with that first, and then I'm going to ask you what you aren't happy with. But start with, what do you like about the future? What makes you optimistic?
I think it's a self-sustaining skill and philosophy. It doesn't matter what other people say about it. If they stop us being registered, if they start telling us we have to do this and that, we can just say, "Oh, bugger off. I'll stop being registered. I'll just do what I want to do." And as we can all do, we don't need to be registered to practice osteopathy. Yeah. Functionally, we don't really need to. But it must be one of the oldest forms of medicine. It must be as old as humankind. It's not like those people were picking their potatoes or whatever it was in 40, 60,000 years ago, and they put their back out and they just sat there and suffered. Someone would have worked out that if you do this and you do that, then, it's a very old, it's the oldest, possibly the oldest profession, and it's ancient.
And they can't take that away from you.
No, they
I
can't
thought
stop
this
me
through COVID. If COVID ever went pear-shaped, I just thought, you know what, I've got a portable treatment table. I put it in my car, and I'm just gonna go do some work, and I'll make an income that way. I was very comfortable. I said to my wife, and I said, don't worry about it. We'll be fine.
Of course we will.
Yeah.
I treat half the street here.
Yeah.
So, I mean, we will be. It will persist because no one else does it. Well, good chiropractors do it, and good osteopaths do it, but I don't think much else is happening. What we do with this global way that we see the body, that if someone comes to us with a chronic chest infection, we will treat the chest infection. And if someone comes with this chronic headaches or sinusitis, or as I said, like John fellow, the incontinence or too sore feet, whatever it may be, we have a way of assessing this, understanding this, and therefore treating it. I don't think anyone else has that. And if you want to see that writ large, talk to a podiatrist, how miserable the podiatrists are, because they're such nice, the ones I know are such nice people.
And my wife's a podiatrist, so I'll have a chat to her in a minute.
Well, okay, well then, you would have taught her that, you can't treat the feet unless you treat the pelvis,
Yeah,
it doesn't make
that.
sense.
Yeah.
But they don't know that. And when you say that to them, their eyes just light up. And I'm happy to share that knowledge with them, but, so that's when I think I don't really care, but then I'm at the end of my career.
Right.
But I think the young ones will be fine. If you practice osteopathy with a capital O, you will do fine.
Great. So we've discussed what you're optimistic about. What do you think are some of the challenges? What aren't you happy with? What's going on right now that kind of says, this is not good for the future? What do you need to see change?
Shame. I think that the people are graduating ashamed that they're not physiotherapists and they're not doctors. I think that's a real problem, and that's only because they don't know what it is that they've been studying. They've been studying everything but osteopathy.
Hello everyone, just a quick break to give you some information on where to best find me. The first place is the private Facebook group called the Successful Practitioner Pathway. I've set up this private group as a place where practitioners can go and get tips and advice on how to best accelerate their practice and improve their clinical practice skills. The second place to find me is at successinpractice.net. That is where the Success in Practice signature program is housed. You can find more information about me and how I can best help you achieve success in your practice. So, the two best places, the private Facebook group, the Successful Practitioner Pathway, and successinpractice.net. I will link to both those places in the show notes, so for more information, please see the show notes. Now, enjoy, and back to the show. And so, given those two positions and what you see, are you optimistic about the future? Are you somebody who kind of saying, we're not really, we can do better as a profession. We need to be maybe doing better lobbying, speaking to tertiary institutions, making our positions clear a little bit better. We've been let down. Are we?
Well, we need osteopaths to be pushing for this.
Yeah.
Not men in suits. We need osteopaths to be doing this. We need to somehow make connections using our osteopathy. But I don't look. It's an arrogance for me to say I know the answer. We will be okay, and I'm happy, as I say, that Xavier's, my nephew, is now this third generation of osteopaths, and his sister will probably do it too. And it's an ancient craft. And if we stop seeing it as a profession and instead see it as a craft, then we know that it's going to continue. It just will.
From the conversations I've had with other people, it's been clear that history has kind of showed that at every point where osteopathy has gained some kind of recognition, it's been osteopaths that have really pushed that. It hasn't been lobbyists or people, like you said, people in suits. National registration and getting the RMIT was a big leap forward. Having a tertiary education. They were all kind of pushed by osteopaths. Ivan had a lot to do with the growth of osteopathy at that time, and I guess you're saying the same thing, that as a profession we need to really step up and put the capital O back in osteopathy. I guess that's the big one, right?
But evidence-based medicine has to be put it back into its box and buried, because it's rubbish.
Right.
It's utter rubbish. You can be evidence informed, but that means you need to know the evidence. And since we don't know the evidence because every person's different, it's ridiculous. We can only go where N equals any study where N is more than 1 makes no sense. N can only equal 1 for an osteopath. That patient laying on the bench is your source of information and your source of evidence. And what that person says when you have finished treating that person is the only thing that matters.
Results are what matter. That's it.
That's true.
Yeah.
Okay. Funny.
And I want to thank you for giving up your time this evening, especially for the listeners, the public listeners today. I'm going to continue this conversation with Anne for just a tiny bit longer, because I know it's late, for my Success in Practice people. Before I let you go, Anne, where can people get a hold of you? Is there an email? Is there
it's Central Sydney Osteopathy in Petersham.
Right.
There's a website there. Yeah.
I'll look that up. Google that, Central Sydney Osteopathy, and Anne is there.
And I'm really happy for students to come and do observations and stuff like that. It's a real thing for me that we need to share information. We don't need to. Anyone that's withholding information, anyone that's nodding at you with your eyes closed as if you're too stupid to understand what they're saying, they're the Buddha on the road that you need to shoot. You need to find people who are happy to share, and that's something I've really found. Even the new graduates from RMIT who came with virtually nothing except their medical science have got so much more to teach me than as much to teach me as I've got to teach them. And I ask them lots and lots of questions now.
Well, that's a very humble position. So on that note, I'll say thank you for the listeners, and thank you, Anne.
My pleasure, my deep pleasure. Thank you.